Welcome back to Health Bulletin. We bring the latest global health updates on COVID-19, including insights on the current dominant variant. And trust me, this is a series of interconnected development you definitely don't want to miss. From vaccine to groundbreaking treatments, the fight against COVID-19 is evolving faster than ever. First, over in Hong Kong, the Center for Health Protection has just announced a change in their COVID-19 vaccination plan. Starting February 25, children and young ones, aged 6 months to 11 years, will receive the JN.1 vaccine instead of the XBB vaccine. This decision comes because the dominant local strain is now of the JN.1 lineage, with around 6,000 doses of the children formulation already arriving, and now authorities are ramping up efforts to stay ahead of the virus. It's a clear sign that as the virus evolves, so do the strategies to combat it. Speaking of evolution, let's talk about the global COVID-19 landscape as we step into 2025. According to recent data from multiple surveillance systems, the overall test positivity rate has shown a slight decrease from 8.5% to 8.1% over the last month across 108 countries. However, while new cases have dropped by 21%, new deaths have, unfortunately, increased by 14%. From December 9th to January 5th, 2025, global surveillance systems have been tracking the prevalence of several key variants. The variants of interest, VOIs, include JN.1, which has been dominant in many regions. Meanwhile, the variants under monitoring, VUMs, include JN.1.18, KP2, KP3, KP3.1.1, LP.8.1, XEC, and LP.8.1. These variants are being closely watched because of their potential to impact transmission rates, vaccine effectiveness, and public health strategies, with the JN.1 variant now accounting for about 15% of sequences in the first week of the year. Now, here's something interesting. While some countries have reported sequences of these variants during this period, others have not. This doesn't necessarily mean the variants aren't present. It could be due to delays in sequence submission to GISAID, the global database for sharing viral data. In fact, some countries that previously reported these variants haven't submitted new data recently. Meanwhile, variants like XEC and LP.8.1 are the only ones currently on the rise. So what does all this mean for us? First, it's clear that JN.1 remains a dominant force, but the rise of other variants like KP2, LB.1, and LP.8.1 shows that the virus is still evolving. Second, the gaps in data remind us that global surveillance needs to be robust and consistent. Now, as winter begins to give way to spring in the Northern Hemisphere, we're observing a decline in respiratory virus activity in the global north. But here's the thing, SARS-CoV-2 still defies a consistent seasonal pattern, so vigilance remains key. It's like trying to predict the weather in a rapidly changing climate. You never really know what's coming next. And in a truly inspiring breakthrough, doctors in London have successfully restored the sense of smell and taste in patients who lost these senses due to long COVID. Using a pioneering surgical technique called functional septorrhinoplasty, they've expanded patients' nasal airways, allowing more odor molecules to reach the olfactory region. In a recent trial, all 12 patients who underwent this procedure reported significant improvements, a stark contrast to those who only tried conventional smell training. It's a small victory, but one that offers hope for millions affected by long COVID. From the strategic vaccine updates in Hong Kong and the dynamic global trends, to groundbreaking recovery treatments in London, these developments highlight how our approach to public health continues to evolve. Each piece of this complex puzzle reminds us that staying informed and adaptable is more important than ever. So what do you think about these developments? Let me know in the comments below. And if you found this video informative, don't forget to like, subscribe, and hit that notification bell for more updates on global health, science, and everything that shapes our future.